So turning to Will's condition, I've spoken to him and he's happy for me to tell you a little bit about how he's doing. You'll be very pleased to hear that he's sitting up in the bed, he's talking to us freely, he's reading, chatting to the nurses during their shifts, talking to the doctors, and generally in remarkable good spirits, given the situation that he finds himself in. The ZMAP we got hold of through our clinical networks here from the hospital, and we've been very well supported by international colleagues to obtain it. He was given the first dose yesterday, and it's too early to say how he's managing and how he's doing, but pleasingly, it seems to have had no side effects in him at all.
Doctor, how, if you say he was sitting up and reading and chatting to the nurses, why did you feel that he needed ZMAP?
The problem with Ebola is it runs a very variable course, and the next few days are going to be very, very critical for him. It's pretty difficult for us to predict what's going to happen, and what we want to do is give him the very best possible chance, the very best possible care that we can, and that's why we use the ZMAP. One of the main motivations is that we had a long chat with the patient about the option that we had of using it, and he was very, very keen to go ahead and wanted us to do so. And that's why we were so pleased to actually have the opportunity to do that for him. So I think it's something he'd probably had been considering in his own mind, because after all, he's a fellow professional in the area. And he actually considered his options very, very carefully. As I'm sure you know, it's an experimental drug, and so he wanted to weigh up what we knew about it, what we thought it might do, how much it might help. And he came to the very clear conclusion in his own mind that he would like to go ahead with the treatment, and that's why we were so pleased that we were able to do so.